Hello and welcome to another exciting episode of We the Doctors. My name is Dr. Jules. We are here on location at Sam Vic's Exquisite Furniture Limited on Sanusi, Fafuwa, Victoria Island, Lagos. And we'll be taking today's topic from here. Today we'll be talking about something that is quite common and it can result to something very, very debilitating. Basically because it is poorly understood. So we are going to help you understand it, of course, myself and my colleagues, Dr. Oke, Dr. Yvonne, and Dr. Valeria. Right, welcome guys.
Hi Dr. Jules. Hi everyone at home.
So today
we're going to make them to understand this whiplash.
Yes, exactly. We are talking about whiplash. I know some people will be like, what is that about? Are we flogging anybody?
Flogging a child?
Yes. The first time it was used was sometime in 1928. But it's basically describing damage to structures of the bones in the neck and also its soft tissue. Absolutely. And we need to let you understand what it is about because, like I said earlier, it can result to something quite permanent. Let's talk about the symptoms now. Let me go first. Whiplash is very painful. I know for a fact because I've experienced it before. Your neck, my goodness, it presents with this excruciating pain. And that pain can also radiate down your arms. And the worst part about it is that sometimes the person comes, they have the pain around the neck, and they cannot move. They'll be like, they can't move their neck. It's very, very painful. That's one of the that's the most common presentation for whiplash. We have others as well.
Basically, you've already talked about neck pain. Sometimes you have this pain on the back that radiates to the shoulder. It's easy to understand because when you said whiplash, I think we should also let them know that it's this flinging movement.
Exactly, especially when you use a koboko and then it just goes like this, and then it's a forward movement.
I like that word.
And then back.
Koboko.
Yeah, that's the word. That's actually koboko. It's a whip. It's a whiplash. So
it just goes to the front and come back. Especially, staying in the car. And then another car hits you from behind, and you know that movement, you just go front and back, basically, and then have the little damage to the soft tissue.
So it gives you a pain at the back that radiates towards your shoulder. So you have this V-like pain fanning out, spreading out towards your shoulder.
Exactly.
Another thing that's very important is headache. It comes with headache, and this headache is usually at the base of the skull. Around that area because of the ligaments and all those tissues, muscles, as in are found around there.
That area.
Exactly.
Yeah, but then again, sometimes some people complain about the jaw pain and all of that. But I think generally, body pains around the area related to the neck, it's called referred pain. You expect that. Sometimes when you have this kind of issue, you don't realize from your head to the whole part of your body, upper part of your body just aches, basically. Exactly. And then some people also have what they call insomnia. They find it very difficult to sleep. Because they're very uncomfortable, the neck is this way, and sometimes even people go all the way and then maybe in the clinic they give them a neck collar and it's not, properly well seated, and then they're not comfortable with the whole stuff.
Since you mentioned insomnia, I'm going to add something that looks weird, but it's something you find in some patients with whiplash. There's this anger. You can't tell where it's coming from. Because you're having pain, the pain is not just going, it's stressful, you're not sleeping well at night, so you have this terrible
especially having to wear the neck collar everywhere you go. You can imagine you having to go to the office, or you having to go even for a very important occasion.
Depression for people.
Yeah, that's true. That's true.
So that's like the secondary effect of this annoying pain. Everything that you're saying is just taking me down memory lane. I'm just reliving that pain. But thankfully, I know better.
Oh, you once had an experience?
Yes. It was very. If you had seen me, I was wearing neck collar all over the place.
But would you tell us what was responsible for yours?
It was the road traffic accident.
Oh, okay.
And like you rightly mentioned, whiplash came up from the anatomical disruption of the structures of the bone.
Like a hypertension.
Yes. So the trailer just hit us from the back. There was a loss of, what I call it brake failure. So they just hit us from the back, and my head just went that way, like the whip, and then the displacement was there. But anyway, we'll be describing more of that and other causes when we come back with Dr. Yvonne. We're talking about whiplash. Don't go far.
Coming up next.
Segment, we're going to be talking about the causes of whiplash. The number one cause I will be talking about, which we mentioned earlier, is the motor vehicle accident. This is the major cause of whiplash anyway. We talked about whiplash before being a distortion of the neck as a result of, usually, most times when people are involved in motor vehicle accident, like Dr. Jules said earlier. Hi and welcome back to We the Doctors. Today's episode is very exciting. It's called Whiplash. I'm Dr. Yvonne, and in this segment, we're going to be talking about the causes of whiplash. The number one cause I will be talking about, which we mentioned earlier, is the motor vehicle accident. This is the major cause of whiplash anyway. We talked about whiplash before being a distortion of the neck as a result of, usually, most times when people are involved in motor vehicle accident, like Dr. Jules said earlier, because they are hit from the rear most times, and so there's the movement that occurs, being that the neck of a human has 7 bones called the vertebra there. So what happens now is that the bones at the upper vertebra actually move forward, and the ones at the lower part are extended as in beyond their normal limits. And depending on the impact of the accident from the back, it can actually disrupt or damage the surrounding organs around the neck. So it's very debilitating, and it's something that we should actually pay particular attention to.
So basically there's a forward movement and there's a backward movement.
So it's this way, yeah.
Yeah, that also reminds me of sports form of accident. And I think the one that comes to mind is, especially in football, you know, that part where you just jump up and you want to head the ball and somebody just push you from behind. You just head your head going up and coming back like that. And then next minute you just hold your neck like, oh, something really bad has happened to me at that point in time. Yeah.
One other thing that comes to mind in whiplash as a cause is physical abuse.
Okay.
So, yeah, you understand this happens fast and it's violence. Let me explain. I'm going to use this to explain something to you.
Don't use me.
No, I'm going to use this. So imagine when you shake this way.
Yeah.
So fast, you are flipping the neck forward and back. And that's common in children. You remember what we used to, there's something we normally call in medicine shaking baby syndrome.
Yeah, shaking baby syndrome.
So you shake the baby up and down, it can actually cause a whiplash for the baby. That's one of the things you find in shaking baby syndrome because of the violence used for shaking them.
And then in some cultures as well, that's another way of, you know, giving someone and say, I'm talking to you or something.
Oh my goodness. So you definitely
and that way it's causing whiplash too. Yeah, pretty much.
Then when you go on these amusement park rides, we have roller coasters. I don't know if we have them here though.
We have roller coasters. Yes, we have roller coasters.
There's one in Ibadan, isn't there?
Of course.
Yeah. There is. Yeah. So if you're going on those joy rides, so to speak, you want to make sure the seat belts are in place or it's functioning properly. Ask questions, because those things, when people talk of accidents, we think of motor accidents.
Yeah, most times.
But you can also have that.
The problem with those roller coaster rides are what happens when electricity fails while you're already spinning. It's like a whiplash.
That's another problem altogether.
That's dramatic.
Yeah, it's very I can imagine.
But it gives you it's the same problem you get whiplash from that.
Exactly.
Really.
Yeah. So these are the major causes of whiplash that we're talking about. Earlier we were asking the question, whiplash. If we didn't talk about it, I'm sure most people won't even know what whiplash is. So we'll be going on the street to ask people, what is whiplash? And we'll be right back.
I can imagine the kind of funny answer you get.
Please stay tuned.
All right, thank you.
Whiplash is a neck injury also known as acceleration-deceleration injury. As a person is moving through space and then stops suddenly, the head will continue to move until it is stopped through its connection of the neck or until it hits something. This injury is most often and most severely seen in auto accidents. However, playing sports and falls can also cause similar injuries. The bones of the neck are usually intact. However, the joints, ligaments, and muscles in the neck stretch and tear and are the primary reason for the pain.
Whiplash is a painful condition which is fairly common amongst people who have been involved in a road traffic accident. Whiplash is a non-medical term used to describe the pain that can occur, generally in the neck, after being in an accident or other traumatic event. It's a soft tissue injury, meaning it affects the muscles, ligaments, and tendons of the body, much like a sprain or strain. Symptoms of whiplash include pain, swelling, tenderness, headache and muscle spasms. The soft tissue nature of whiplash can make it difficult for a physician to diagnose and offer treatment beyond prescribing rest and pain relievers. However, some whiplash injuries can be serious and may result in incredible pain, leading to lost wages, ongoing medical treatment, and more.
I'm just hearing about it. I don't know much about it.
Wow, I don't know about it anyway. Yeah.
How does it operate?
About whiplash. What's it for?
Sure, I'm not a doctor. I don't know what it's called. Is it?
Before the moment of impact, the person inside the car and the car itself are resting without motion. As soon as the car is hit from behind, the mass and energy from the moving car begins to transfer energy into the stopped car. What most people don't understand is that the body of the person sitting in the stopped car will not move immediately with or as quickly as the car they're sitting in. But instead, there is a lag in time before their body starts to move. In this graph, we have time going along the bottom and g-forces are on the left. The steel frame of the car being hit will begin to accelerate forward from the impact. However, the person in the car will resist moving due to Newton's law of inertia. What will happen is the vehicle will begin to move before the occupant. The vehicle may actually move several inches forward while the person's torso begins to increase pressure against the back of their car seat. Note in this picture how the driver's hand is off the steering wheel. Then, the pressure from the seat shoots the torso of the human body forward like a diving board propels a diver. The torso moves first, and because your head is somewhat like a bowling ball supported only by your neck, your head will remain motionless for a few more milliseconds. So the car moves first, then your torso moves out from underneath your head. This forces your head to suddenly have to accelerate to catch up with the car and your torso. This very sudden acceleration of your head causes 2 points of stress in your neck. The first stress point is at the cervical vertebrae C5 and C6, and the other stress point is between the cervical vertebrae C1 and C2. These two areas of our neck usually get the most damaging forces, which oftentimes tears or permanently stretches the ligaments that hold our vertebrae in their proper place. It is these exact same laws of physics that cause mild traumatic brain injuries. Our brain is very complex and made up of 2 types of brain cells. The center of our brain is called white brain matter. And then there is the gray brain matter, which surrounds the white matter. Our brains are floating in a liquid, which is cerebral spinal fluid, all housed inside of our very hard skull. It's important to know that the white brain matter is much more dense and heavier than the gray brain matter. And there are billions of cells in our brains.
Hello and you're welcome back to With Us Doctors. If you're just joining us, we have been talking about whiplash. I'm sure it's been really interesting getting people's opinion about what whiplash is all about. And on this segment, we'll be telling you about things to do if you already have a whiplash or you realize that, you know, the structures of your neck are not in place or you're having pains as a result of that. I think one very simple thing to do is that you can go to any pharmacy around you, over the counter, and you can get analgesics. Those are pain relief medications to relieve you of the pain you were feeling at that point in time. Dr. Yvonne, what other things can we do basically?
Yeah, to add to what Dr. Valeria just said, the pain relievers, please, I would like you to also seek your doctor's consent, because it's not any kind of pain reliever you can just pop in, depending on your medical condition. Then secondly, we would like to add that ice pack is very, very important to use. This you can use not directly on the skin to avoid injury. So you can wrap the ice around a towel and put gently on the neck for about 20 to 30 minutes, like 4 to 6 times daily for about 3 days. So,
yeah, that really helps a lot. But remember that you need to wrap the ice, so you don't put the ice block directly, so you don't have a damage to your skin.
Exactly.
And basically, depending on which country you're in, where you're listening to us from, your doctor may request that you see a physiotherapist or a chiropractor. They just help you with physical therapy on the neck and actually relieves the pain and the troubles you get from the whiplash.
Exactly. Now, you know, when you have a fracture, you probably use a POP. The same thing, the same principle guides the use of a neck collar. Some people might find it embarrassing that you're wearing this thing and you're walking around looking very stiff. But believe me, it helps because it keeps that place stationary to aid the healing. I would not advise you to go and just get the collar yourself. Like Dr. Oke said, it's your physiotherapist that should get, like, will I say, measure out one for you that will suit your neck, because people have different neck sizes.
And then remember that you're not even wearing the neck collar for the rest of your life. It's so there's no reason for you to feel bad about it. Now, the final note is this. You might need to get a psychologist, especially people who have started having depressive issues as a result of the whiplash. So you might need to get someone to talk to, all right, to make you feel a lot better and reassure you and understand that, look, this is not a permanent thing. After a while, you get a lot better. Dr. Oke, what questions do we have from us?
Yeah, we have a question from Nguyen. I hope I got the name right. Nguyen said he has been following. No, Nguyen said he has been following us on YouTube.
South African.
He hasn't really watched the show on TV. I guess, maybe South African. I'm not sure. I'll have to find out later. That she hasn't really watched the show on TV, but she has been following our old episodes on YouTube, and she wants to know that can she get whiplash from cracking her neck? I guess she's talking about these things that we do.
Okay, people do a lot of...
Dr. Oke used to crack his neck. Let me just chip that in there.
Okay. Again, I'll give you the answer to I'll give you the answer to your question. Really, you can't, because whiplash is a very fast movement. In microseconds, you've completed both the forward and backward movements. This is going to take me at least a second to do. So I don't think that's enough to give you a whiplash. But I won't advise you to keep doing it though, because she's right. I cracked my neck and I'm trying to stop. Maybe we should have to try and stop on our. Let's start. What's it called? Tag team. Let's do a tag team and know when we're going to stop it together.
Exactly. Because long-term effect of that neck cracking can cause other issues.
Absolutely.
So we want to stick to with the doctors. Thank you. Was her name again?
Nguyen
for following us up on YouTube.
Maybe she's Kenyan.
Maybe. So most of our questions, we get them from our handles is at We The Doctors, okay? And you can also get more information about the TV station. It's cooltv.cool. We've been talking about whiplash today. This has been a fantastic episode.
Absolutely.
And we want to say a big thank you to Sam Vicks Exquisite Furniture Limited. It's here, 19 Sanusi Fafunwa in Victoria Island, Lagos.
I think I should take this one home though.
Yes, you should.
Yeah, it makes a lot of sense. It feels very comfortable.
Too comfortable. So that has been our episode for today from Dr. Jules, Dr. Oke, and Dr. Valeria, and Dr. our fantastic and our beautiful Dr. Yvonne. We're saying bye-bye and stay healthy.